Cybernetics in tissue, and how an algorithm measures, evaluates, and supports regulation with microcurrent and light. And with that, a very warm welcome to a new podcast from Luxxamed GmbH. My name is Patrick Walicek, and in this episode, yes, we're going to do a little deep dive, specifically a deep dive into cybernetics and how feedback processes actually offer the possibility to control and regulate complex systems with physiology and biochemistry. Yes, and then of course, how the Luxxamed algorithm uses these principles in practice, how it measures, evaluates, and how it dynamically regulates the dose of microcurrent and LED light. Of course, a quick disclaimer here as well, because we are talking about medical microcurrent therapy, meaning the application for professional users like therapists and doctors. Of course, patients are also welcome to listen to our podcast, but the actual practical tips and recommendations are of course aimed exclusively at these professional users who also have to consider and evaluate the application within the framework of the Medical Device Operator Ordinance. So, but very importantly, by the end of this episode, you'll have a very clear picture of what we measure, why we measure, how we measure, and how transport, ion flows, and ATP-coupled processes help to bring about a sustainable steady state. That is, after all, the point of regulation. Now let's dive in, and we'll start with cybernetics, meaning the control loop. Pushing the button, if you will. What does cybernetics mean? Cybernetics means we work with feedback. The human organism is an open system. It continuously exchanges energy and substances with the environment. Blood flow, lymph, ion channels, hormones, autonomic nervous system. These are all control loops. They have certain set points, they have certain measured variables, but they also have certain manipulated variables. And therapy in a cybernetic system ultimately follows 3 steps: measure, evaluate, and regulate. And that's exactly what we've been doing with the Luxxamed application since 2010 to be precise. We started back then with the Luxxamed HD 1000, which was followed by the HD 2000, HD 3000, and now the third version, the HD 2000 Plus. So we record electrical response patterns of the tissue, classify them physiologically, and adjust the stimulation parameters accordingly at short intervals. And that's how guessing parameters becomes a guided intervention, because we always have the feedback of the tissue to guide us. To put this into a bit more context, we need to discuss a few terms from, physics, biophysics, whatever, because they play an extremely important role in understanding the background, both scientific and technical. Specifically, I'd like to talk about the terms entropy, enthalpy, and free enthalpy. And I want to try to make this somewhat understandable because the terms sound, very academic at first, but they are actually extremely useful clinically. Specifically, I'd like to talk about the terms entropy, enthalpy, and free enthalpy. And I want to try to make this somewhat understandable because the terms sound, very academic at first, but they are actually extremely useful clinically. Let's start with enthalpy. Enthalpy has the symbol H and is roughly the, heat and energy content of a system. In tissue, this is reflected in blood circulation, temperature, fluid distribution, and of course, the heat of reaction. Entropy, which would be S, describes the distribution of energy and also, of course, of particles, how ordered or disordered the system is, so to speak. Finally, we have free enthalpy, which is delta G, and that tells us whether a process can occur spontaneously, meaning whether it runs on its own or is driven externally. And in the formula, for example, delta G, if you take delta G, is equal to delta H minus T, which is temperature times delta S. And in the end, if delta G is negative, a process runs on its own. Let's apply this now. It sounded relatively abstract, of course, but let's apply this to tissue. When we have acutely inflamed tissue, this is actually often exothermic. That means it's warm, it's hyperemic, it's edematous. And in this case, the H, meaning H is high, and the S is high, metaphorically, too much flow, but too little order at the same time. Yes, in the overall construct. Let's look at the opposite. We have chronically rigid tissue. Then we have, that's more endothermic. It's rather cool, poorly perfused. It's more viscoelastic, so rather tough. There we have a low H and a low S, which in turn means we have too little flow and the energy is, so to speak, stuck in the tissue. Why is this important? That's a very important aspect, of course, because microcurrent therapy doesn't work through, yes, let's call it contraction controlled or stimulus transmission blocking effects, but rather regulatorily on transport, ion flows, membrane potential, and ATP coupled processes. And these react completely differently to the same dose depending on the initial state. And that's why it's also, yes, I don't want to say pointless, but that's why it's important to use a feedback controlled method, because these states are virtually unmeasurable from the outside. And we offer these measurement methods with the Luxxamed to generate this feedback and determine the dose. Therefore, measure first and then dose. Now let's come to the cellular basis. I think that's also a very important aspect. We've talked about the cellular stories in the past, in training sessions, or of course, in various podcasts quite a few times. And let's look at the ion gradient, the membrane potential, and ATP, of course. Every cell maintains a certain ion gradient. High potassium intracellularly, high sodium and chloride extracellularly. But that costs ATP. So it ultimately costs energy because the Na plus / K plus ATP ACE pump is permanently pumping against the gradient. And that's what creates this, yes, membrane potential, which if you look at it closely is ultimately the working language of the cell. So it controls the channels, the transporters, the receptors, the enzyme complexes, the volume, and of course the pH situation in the tissue. In this context, ATP is the, yes, let's call it the energy currency. As I said, we've talked about this often in the past. ATP is the energy currency. It is produced mainly in the mitochondria by the respiratory chain. Pre-damaged tissue or overloaded tissue usually has less ATP. Thus, a disrupted transport is more prone to edema and, of course, has increased nociception. And this is exactly where we start with targeted medical microcurrent therapy. We influence the electrical boundary conditions, if you will, which means we influence ion movement and the electroosmotic flows are thereby facilitated and all ATP-dependent processes can be regulated or coupled with this. That is, I think, one of the aspects that also explains. This has also been shown by various studies. I'd just like to mention Cheng et al. Regarding ATP production, who themselves conducted studies and investigations with Schönfelder and Wetzel et al. That simply show we can dramatically increase cell vitality and cell regeneration with this. But now, of course, the opposite question. Why so little current, one might argue, meaning microcurrent, right, in the thousandth or millionth of an ampere range, can work so well here? And we have to look at Astumian et al. He wrote about electroinformational coupling, meaning electroconformational coupling, and published a paper on it many years ago because many membrane proteins are electrosensitively coupled. Yes, that's always a very interesting observation, also scientifically proven. And even small fields, meaning the smallest electrical fields in the microampere range, can shift the conformational state and thus the transition probability minimally, if you will, like a conductor, quietly setting the beat for an orchestra, and the orchestra follows the beat. What is the consequence of this? We work, if you will, subsensorially without muscle contraction. This is well known to most users of microcurrent therapy, but perhaps also highly interesting for patients because it makes this procedure very, very pleasant. So it doesn't hurt. We don't have this uncontrollable muscle contraction that we know from classic electrotherapy. The effects can therefore be described as regulatory, to be emphasized, and not mechanical. In the end, the tissue decides on hydration, ions, pH, temperature, and of course, the matrix state. But now let's come to let's call it a side player in the whole situation, especially what we use in medical microcurrent therapy, meaning BCR, biological cell regulation therapy. That is the so-called photobiomodulation, referred to as a co-regulator. We use light therapy within or parallel to microcurrent therapy. We have a red, a blue, and a green light here, which is specifically tuned. And especially with the red light, we can, for example, modulate cytochrome C oxidase in the respiratory chain. We can release NO blockages and thus improve oxygen utilization and the ATP rate. We have also conducted investigations on this at the Fraunhofer Institute, specifically with the Luxxamed HD 2000+, and were able to prove exactly these effects. In practice, we use the light additively with the Luxxamed, if you will. Of course, the focus is on microcurrent therapy. The microcurrent organizes transport and ion flows, and light, if you will, opens the mitochondrial window. The algorithm can thus, so to speak, coordinate and align both parts, which of course dramatically improves the symbiotic effect. Let's go a bit more concretely into the technical area. So what we always mention or also emphasize is that the Luxxamed is of course not a diagnostic system. That's very clear. It is a therapeutic system, but we do have a form of measurement. And if we look, before we stimulate, we test. Users or patients who have been treated with the therapy before know this. We have a measurement phase. This means the system applies small measurement pulses and records the electrical response of the tissue. And that's actually the whole secret. So we put a pulse in and we achieve resonance. Many people know this from the field of FSM, frequency-specific microcurrent, but that is of course only an isolated part as far as frequencies are concerned. Here we record the entire electrical response of the tissue over several frequencies, over the polarity, and beyond that a reaction curve is created. And if we look at that, we see the conductivity, so to speak, the impedance of the tissue, which reflects the ion mobility, the hydration, and also the matrix density. At the same time, the reaction enthalpy, to put it simply, the heat, or to put it another way, not just the heat, but the difference between heat and rigidity, meaning the contrast. In the end, that reflects this so-called reaction enthalpy. At the same time, we have a time behavior that we also measure because we have a relaxation time, a saturation, and yes, a recovery capability of the tissue, which we can also more or less measure through this. And the algorithm compares these patterns with a certain target corridor and then selects the corresponding microcurrent parameters, that is, the current intensity, of course the voltage, the polarity, and if necessary, also the duty cycle, and so on. And if useful, the components of the LED light therapy, that is photobiomodulation, are also adjusted. You can see this in the different colors for those who have already experienced or performed this. And the whole thing is carried out and measured at short intervals. And if we then come back to the definition of cybernetics, yes, then we are exactly in that, because this is a so-called closed-loop control loop, and thus, this is the quintessence of it, the therapy follows the tissue feedback and not vice versa. In the classic microcurrent therapy procedures, as we also performed them ourselves from 2000 to 2010, until the first Luxxamed came onto the market, we did that too. So we took a state, a tissue, put it in, and said, the tissue must now follow our specification. And that is exactly the error in reasoning, because we need the feedback, because the therapy must follow the tissue and not vice versa. That is exactly one of the most important points. Yes, from the measurement in the end also to the dose, that is ultimately the control strategy, and there we have 3 steps that are carried out every time. First, of course, measure. Is the pattern rather exothermic inflammatory, meaning high flow, low order, or rather endothermic rigid, meaning too little flow and the energy is, so to speak, trapped? Or are there also metastable areas? Those certainly exist and can occur in therapy. And second, evaluate what physiological goal is realistic today. Right? That's also important to consider. It's often forgotten. Does transport need to be facilitated here? Do we need edema drainage? Do the ion flows need to be organized? Or do we ultimately want to open the ATP window to provide energy directly? And third, of course, regulate. This means the algorithm doses microcurrent and light, checks the response curve, pauses or changes the program. Now, program doesn't mean therapy program, but rather its program based on current intensity, polarity, frequency, and of course, voltage. As soon as the specific target corridor that is set is reached, yes. So that means we try to trigger the processes in a targeted manner through small impulses instead of following the motto, more is better. Let's translate this a bit more into clinical patterns to make it a bit, yes, more tangible, yes. Let's look at acute inflammation, irritation, for example, bursitis or tendinitis. What are the clinical signs? We have heat, we have swelling, we have tenderness, we have painful movements. And in terms of thermodynamics, we have 2 things. We have a high H and a high S. That means we have high flow and low order. What is our objective now? Of course, to channel the flow. That is, to support electroosmotic drainage and simply modulate nociception. Practically speaking, we make sure that we place the electrodes, if we assume the classic adhesive electrode approach, basically along the drainage pathways and not directly on the pain, and then do this subsensorially for 20 to 30 minutes at short intervals in the first week. It makes sense, especially with acute cases, to work relatively, short term, meaning to intervene at relatively short intervals. And with that, we are, if you will, actively assistive with small amplitudes, mobilizing the course in the end. So, right, we will see the response curves. The pain will decrease parallel to the tissue feedback, actually. At the same time, if we look at the range of motion, the ROM, for example, that will, of course, improve. Let's move over to chronic rigidity. Let's take, for example, conditions like achelodynia, old scars, or myofascial imbalances. What does it look like clinically? It's rather cool, tough, reduced conductivity, fluctuating pain peaks. And looking at thermodynamics, we have a reduced H, we have a reduced S, so too little flow, and colloquially speaking, trapped energy. What is the therapeutic goal in the end? We want to increase order, open microcirculation, change matrix viscosity, and simply re-establish or reset the ion flows, if you will. This also means we need series with longer stimulation times, and here it makes sense, of course, to place electrodes along the functional chains, that is, origin, insertion, fascial lines, and so on. And yes, in post-session loading, we should make sure that we can slightly increase the load, thereby improving the glide, so to speak, in relation to the muscles. And thus we gain a certain dynamic and recovery capability relatively quickly. This also increases the clinical resilience from session to session and thus decreases irritability. This means, and there are interesting studies on this, I've also done a podcast about it, that specifically the combination of microcurrent and manual therapy, osteopathic, chiropractic techniques is highly recommended, because we see here, and we conducted a study ourselves in 2010. This was a post-operative randomized patient-blinded study in patients after knee arthroplasty, and especially regarding function, resilience, and decreasing irritability, we were actually able to achieve significant results. And that is just one example of how important combination therapy is here. Let's move on to the next clinical point. Let's look at post-operative early rehabilitation. For example, yes, shoulder after rotator cuff surgery. And here we also have pain, swelling tendency, protective guarding. And here our goal is the resolution of inflammation accompanied by opening the ATP windows in order to, yes, preserve the so-called gliding planes at the end of the day. And here too, of course, or here specifically, it should be applied locally to improve functional resources, increase ROM, and thus also, yes, the electrometabolic target curve simply to increase or improve. And here too, of course, or here specifically, it should be applied locally to improve functional resources, increase ROM, and thus also, yes, the electrometabolic target curve simply to increase or improve. And then we also have the point, of course, an important aspect, athletic recovery. And there we also have the problem. We have a lactate metabolite problem that needs to be broken down or cleared here. We have the problem of microcirculation. We have an autonomic rebalance that we have to perform. And with this, we actually have to apply the recovery sessions immediately post-exercise over a large area. If we're talking about electrode placement, again, we should, of course, work over a large area here. And, of course, always with LED light therapy. In the past, this has always proven to be very, very positive. And approximately, if you take the pre-mode before competition, before training, we are at about 20 to 30 minutes in competition mode, also logically in daily mode, which, yes, in the course of the day leads to a faster feeling of freshness, better subsequent performance, but also better rehabilitation or recovery. And we also conducted investigations on this quite a few years ago with a professional boxer, Robert Stieglitz, where we investigated with a team of sports scientists how his recovery and, yes, of course, individual feeling after training changes, especially after hard interval training sessions with and without microcurrent. And I've already talked about this in the podcast. It is de facto the case that we were able to record a significant improvement in performance, especially at the anaerobic threshold. We have a faster decrease in lactate, and his, yes, personal opinion was simply that he feels recovered faster. And that simply shows that the topic works very, very well also in sports performance enhancement. Yes, let's look a bit deeper into the mechanisms. I think that's also a big topic for many. Many are familiar with or go into the field of frequency therapy, that is frequency-specific microcurrent therapy, and only see the frequencies. Yes, let's look a bit deeper into the mechanisms. I think that's also a big topic for many. Many are familiar with or go into the field of frequency therapy, that is frequency-specific microcurrent therapy, and only see the frequencies. But perhaps we should also consider things like electrodiffusion and electroosmosis here, because these are things that cannot be argued away in frequency-specific microcurrent therapy, because these are things that simply arise from the current itself, regardless of the frequencies. And I think that's why it's also important to look at this, because weak electrical fields facilitate and transport along charged fields. And that is particularly relevant, for example, for edema management. Then we have endogenous DC, meaning direct current currents. If we look at them in injured tissue, these are so-called currents of injury, which have been described, for example, by Robert O. Becker, who is also cited a lot in this field. And these can simply have a supportive effect in representing the conduction gradients for cell migration in the end. And let's also look at the matrix interaction. The extracellular matrix is a charged hydrogel, if you will, and electrical fields load or influence the integrin bonds and the cytoskeleton, and that plays an extremely important role, especially in mechanotransduction. And thus we are also in microcurrent therapy because we apply it externally. That's why, yes, this DC field applied from the outside is a very, very important parameter that initially has nothing directly to do with the frequencies, but purely with this weak electrical field. And if you look a bit closer, there is, of course, also this autonomic coupling because we have improved microcirculation and modulated nociception. This reduces the sympathetic load and promotes parasympathetic rebalance. And that is totally important, not only for the healing process, but I think everyone who is active in the sports field, stress field, burnout prevention, etc., knows that we really have a very, very important aspect here that we can address with microcurrent therapy, which is really important and right in that area. Yes, regarding the practical guidelines, let's look at that. The dose of microcurrent therapy, so how is it so it becomes, if you will, consistent? Microcurrent therapy is subsensorial. We've already talked about that, but we have certain windows that we can open, yes, to influence inflow and outflow pathways. So to influence them and thus really have an impact in the short term on acute and often also on chronic, longer, serial problems. It is fundamentally important, regardless of whether we are talking about acute, chronic, etc. Of course, hydration, that is drinking enough, because without water, there is no transport. That is accordingly totally important. And we always say that in all training sessions and so on, that a certain hydration of the patients is totally important here. Then, of course, we can also talk about certain co-therapies. I mentioned earlier osteopathy, chiropractic, manual therapy, active training, totally important. Respiratory therapy, yes, also a really important, yes, co-therapist in the context of microcurrent therapy. And of course, I would like to address the topic of clinical hypnosis, not least for personal reasons. Together with Dr. Schellenberg, I have already been able to train some therapists and doctors in clinical hypnosis, and that is really an excellent combination therapy, not only with cybernetic microcurrent therapy, but also generally with microcurrent therapy. Yes, documentation is also a topic. It is, of course, important that we use a certain form of documentation. And here we have the advantage with the Luxxamed that the patient management system, of course, provides documentation of the response curves from the therapy, where, for example, the reaction enthalpy, if you will, is also recorded. And that is also a form of quality assurance. And it is also important that you have classic documentation in the first place, but also that you can really display measured values, curves, and images that you can show to your patient, so to speak. Before we finish, I would like to address a few misunderstandings briefly and clearly, because these are misunderstandings that arise in my daily work during daily calls from interested therapists and doctors, from customers, but of course also a lot from patients. Let's start with the first one. More current helps more. Of course, a clear no. We control loops with microcurrent therapy. That's why it's so pleasant, or to put it another way, not unpleasant. We don't have this muscle twitching, this contraction, this pain that occurs with therapy, because we really try to control the whole thing subsensorially, yes, and to intervene in the metabolism. Yes, the next point would be a fixed protocol is always enough. And to that I say very clearly, no, it's simply not always enough. And resonance or not, meaning the resonance effect, if it's not measured, then it's relatively difficult to perceive a resonance at all, because how else am I going to perceive it if I can't measure it? And how am I going to adjust or change something if I haven't measured it? So no, the states change, and here it is totally important that the dose, meaning also the composition of the protocol, follows the measurement, thus follows the tissue. Important, I think it's also logically physical, medical, and technical in the end. Microcurrent replaces movement. That is also such a piece of fake news, if you will. No, microcurrent opens the window, energetic window, the metabolic window, and the movement stabilizes itself through this gain from opening the window. Yes, what does the algorithm actually take off your hands if we refer to the HD 2000 Plus again? What does it actually take off your hands in everyday life? Yes, in the end, it's like this. The adaptive programs follow the tissue response. That means more transparency. The course becomes more visible, not only for you as the user, but also for the patients, for the team. You have better use of time. While you are mobilizing and guiding, the system maintains. That's the beauty of being able to combine it directly, the so-called metabolic target corridor. And with that, I would like to conclude, and I would like to give you 3 core sentences to take away. First, tissue is a dynamically open system. Disorders are always thermodynamic shifts and not broken parts, because which cell at the end of the day is actually sick voluntarily? That would be the opposite question, of course. So we work with open thermodynamic systems, and anyone can read about that in biology or biophysics. That is a fact. Microcurrent works regulatorily. That is the second key point I would like to share. So transport, ion flows, and ATP or ATP production, which achieve a great effect with small impulses. And third, our algorithm, which measures, evaluates, and regulates in a loop. This is how the therapy is guided, instead of having to more or less guess it using fixed protocols. And with that, we are now at the end of this episode. I hope I was able to give you a bit of, it is indeed a difficult topic. For example, this coming October, for those who listen to the podcast a bit later, it is currently September 12th, 2025, and we are starting a seminar series in mid-October, namely a series on the basics of microcurrent therapy with our doctor and orthopedist, Dr. Voracek, who has spent a very, very long time dealing specifically with this electroconformational coupling and ultimately developed the algorithm for microcurrent therapy from it. He has been a user himself since 2000, so now for 25 years a user of microcurrent therapy, and logically knows his way around all areas regarding frequencies, polarities, current intensities, and so on. And we have him as a specialist speaker live here with us in Kassel again in October. And I think we've already almost reached the maximum number of participants for the seminar. And then comes Florian Schöning. Florian Schöning, alternative practitioner, physiotherapist, osteopath, expert in the field of frequency-specific microcurrent therapy, and he talks about FSM according to Dr. Carol McMakin. He is a trained instructor himself by Dr. Carol McMakin and simply passes on his knowledge to therapists and doctors specifically related to the FSM area. You can find all of this in our show notes via the link that takes you directly to a blog post of ours. And there you will, of course, find all advanced training courses, all dates, etc. Yes, so in short, I would like to say thank you very much for staying with us for so long, even if this episode might not have been so easy in terms of wording and the topic. But I believe it is important and right to address these topics here as well. In that sense, thank you once again for tuning in. Thank you very much for being with us for so long. Check out our social media. Look for Luxxamed on Instagram, Facebook, and of course on YouTube. And follow us and of course subscribe to our podcast. Very, very important and right. Yes, and in that sense, I say thank you very much and see you next time.